Hello, everyone. I thought I'll put together a couple of slides on some frequently asked questions or issues that came up during the face-to-face workshops and some of the questions that I've been getting via email. I would encourage everyone who've got questions or queries to post them on the Moodle site so that others can benefit or others can respond to the queries that you might have. Okay, the first one, I guess, it's a tip, key strategy to ensure that you have a successful project is to engage with key stakeholders. I would encourage everyone, before you even start or you formulate the idea for a project, have a chat with your manager, direct supervisor. That could be your NAM, educators, or senior clinicians such as clinical nurse consultants. This is a very, very important step that will guarantee your success because you need their support and you need their approval for your project. Managers might also have some ideas of some ongoing or already existing quality improvement projects that you might undertake as part of your assessment item for this subject. So it is very important to engage the stakeholders and to seek approval and support of your direct manager. When you go and do this, you really need to ensure that you sell the benefit of your project. Your project needs to add value to the area that you're working in. So it's very important for you to have a clear idea of your project in terms of the population, the intervention, the control comparison, and the outcomes that you want to achieve and how you're going to measure those outcomes. Another strategy that you might utilize is to involve champions. In most clinical area, there are champions for things like infection control, patient safety, patient falls. These are clinicians who are dedicated or who really focus on a particular area of interest. These people might also have some ideas of some ongoing projects, things that they have done, or some tools that you might utilize. For example, some audit tools. You need to ensure that your project is realistic. Remember, this is a work-based project, what is commonly known as a quality improvement project that should be undertaken, planned, undertaken, and reported within the 12 or so weeks of the semester. You really need to ensure that your project is realistic, you've got realistic timeframes, and you've put in place some extra time in case of some unknown challenges. I think these are really important key strategies that you might want to think about before or as you develop your project. The other main thing that came up was regarding the sample size. A number of students really had queries regarding, what's the optimum or what's the best sample size. There's really no silver bullet to this question, but as a general guide, the larger the sample size, the better. So this is my advice to everyone. The larger the sample size, the better, because it's easier for you to demonstrate outcomes and to measure outcomes and to provide meaningful evidence if you have a larger sample size. A larger sample size allows you to generalize results outside your clinical setting. Another way to think about the issue of sample size is to look at what we call a response rate. This is a proportion of the total population site that you collect data from. For example, if your area has 30 nurses and you audit or observe 20 of them, or you observe some hand washing practices or manual handling practices of 20 of the 30 nurses, then you've got a 67% response rate. But if only 18 nurses participate or you observe only 80 nurses, then of the 60, that translates to 33%. So you can see how response rate is very, very important. In general terms, the higher the response rate, the more representative the results that you get from your sample. In healthcare settings, we generally aim for a sample size that is greater than 60. With this in mind, as a general guide, for this subject, I expect a sample of at least 50. So if you're looking at patient charts, if you're collecting data through observations, if you're doing an audit of practices, aim for 50 as a bare minimum. But that said, the larger, the better. If you've got issues, please feel free to get in touch with the subject coordinator so that we can discuss the particular clinical setting that you are in and particular issues regarding your setting and your study, so that I can give you some advice regarding the most appropriate sample size. If you so happen to work in a small area, maybe you work in a GP practice or in a community setting where you've got very low numbers, a common strategy that you might utilize is to collect data over a long period of time. For example, you might collect data over 2 or 3 weeks. Let's say if you see five patients per day, or there are 5 nurses per day, or 5 patients per day, 5 patient audits or patient charts. If you look at those 5 times 5 days, that's 25 times 2 weeks, that will give you 50. If you do that over 3 weeks, that's 75. So that's a good strategy that you might use if you're concerned about the size of your sample. But again, please feel free to seek advice and assistance regarding this matter. Another common question was regarding the study design. Really, again, just like sample size, your study design is determined by the aims or your project question. So the aims drives the design, not the other way around. So once you come up with your aims and design, then you need to select the study design that is really relevant to your study aims. But keep in mind that this is a work-based project, and we discussed that you don't require ethics for this. There is a checklist on the model site that you need to complete before you design and finalize your project. Therefore, the following study designs are not appropriate. You cannot do a randomized controlled trial. You cannot do a quasi-experimental designs, because these you've got to randomize people, have got to randomize procedure and offer different interventions or different level of care. So you cannot do a randomized controlled trial. You cannot do quasi-designs, as these require ethics. You also cannot do focus groups because they involve collecting data directly from participants. So you can't undertake any of those studies that require ethics. But examples of some study designs that you could do are some audits, pre and post-test design. You could do some observations of practices. All the data that you need to collect should be non-identifiable. This implies that you cannot collect patient names, date of birth, addresses, or any personal information that can potentially make them identifiable. I'm also happy to discuss this further if people still have any questions or queries. Another issue that came up was regarding privacy and confidentiality. As I've said before, you should not collect any data that identify people. You cannot collect names, people's names, ages, or people's names, addresses, medical record number. You cannot identify facilities by name or hospitals by name. You can, however, provide a general description of your setting so that you provide sufficient information to give the context of where your work-based study will be conducted in. For example, you could say a 35-bed acute care ward in a large metropolitan hospital. You could also say a 65-bed high care residential aged care facility in Sydney. These are examples of the descriptions that you might provide. Certainly, you can provide more information, and I'll give you an example of how you can describe your setting or your context. Okay, others are planning to do a systematic review if you're doing 998, or a rapid review of evidence if you're doing 905. So people were asking, how many databases do you need to search? As for the information that is posted on the module site, you need to consider the key health databases that you can access via the library. Examples are Medline by Ovid, Chirao, Scopus, and Cochrane, the Cochrane Library. More details are available on the library website, and you might need to have a discussion with the librarian for some assistance. As a general guide, for a rapid review, you need to have at least 2 databases. For a systematic review, I expect you to search in 4 databases. It's very important that you develop you clearly develop your search strategy, as this is one of the most important difference or the key components of a systematic review or a rapid review. You need to undertake a comprehensive and systematic search of the chosen databases. Okay, another question is, I'm doing a project with a team at work, and can I use this as the assignment for this project? Well, you need to bear in mind that this is an individual piece of assignment, so you need to you need to demonstrate that you had a substantial contribution to the project that you're undertaking in terms of the concept and design, data collection, the analysis and the interpretation of the result. You need the best strategies to include a separate component that you do independently to that project. You might collect extra data. You also need to seek consent and approval from your other team members. You need to ensure that the project is realistic and it meets the required timeframes. You also need to discuss with the subject coordinator if this is your case. If you're already involved in a quality improvement project or a work-based project, and you decide to use components of that as part of your assignment for this subject, you need to have a discussion with me so that we can discuss the particular parts or components of that you can do as an individual piece of work and submit as a project. Okay, some people are still not clear about what's included in assignment number 2, which is your project proposal, but the structure and examples and templates are provided in the course module site, in the subject module site, but I'll go through some key components, and I'll demonstrate this with you as well with an example of a project proposal that I'll present in the next presentation. You should have a title page. You need to have an introduction that explores and gives rationale and significance of your project. This is really a literature review of the most recent evidence regarding the topic that you want to focus on. You should have an aim, if possible, a question that drives your project. You need to provide sufficient details on the context and the setting so that we can have an understanding of the nature of the challenges and the setting where your project will occur. This gives me a good idea of the nature of the data that you're collecting. It also helps to see if your project and your results can be transferred to other similar clinical areas. You need to provide a brief review of the literature as well as part of your introduction, and the literature needs to be relevant and be specific to your project. You need to explore and provide information on the design and methods, including how you're going to collect data, how you're going to analyze data. You need to provide proposed timeframes in a grant chart. You need expected outcomes to describe what outcomes you're going to measure, how they're going to demonstrate and address your research aim and significance. You have a reference list as per APA referencing requirements. You are also expected to attach appendices or appendix. You might put the poster or the audit tool that you're using. For a systematic review or rapid review, you need to include your search strategy for one of the databases as a bare minimum. Okay, these are a couple of, hopefully I've addressed a couple of the key questions that you might have. Certainly if I've missed something or if you've got any other burning issues, feel free to post them on the module site so that everyone can benefit and others can respond to your queries as well. Thank you.